Hopefully that will help with some of the background noise, folks. Hello, hello, hello. Welcome to another episode of Spilling Tea. I'm your host, Tiffany Daniels. We are going to be going back to our little Medicaid mini-series, but first, brief disclaimers slash trigger warnings for this one. Folks, on this channel, we do talk about some pretty dark subjects. And we also tend to use profanity. So if you are someone who has a child who is 16 and younger that will be watching this, parental supervision is something I very much advise. All right, we're getting in a little bit more regards to Medicaid, in particular what we are looking at in regards to the cuts, particularly the $83 billion that the Trump administration is going to take out of an already skeleton crew that is just barely hanging on by its fingernails. So what we're going to be getting into today specifically has to do in regards to direct care support workers, which have been facing a major shortage and require for workers for quite some time. So we are, of course, as usual, going to also include in the description box. Oh my God, sorry folks. We're going to include in the description box the link to this particular article, and we're going to go ahead and get on through it, okay? Alright, so long-standing workforce challenges in Medicaid home care, also known as home and community-based services, or as we know it in professional lingo, HCBS, impact care for 4.5 million people who use these services, and addressing them is top priority for most states. Now remember, this is not just talking about folks like myself who get community integrators there to assist us during transition time in learning valuable life skills as we transfer from the high school days more into adult servicing. This in particular also covers elderly folks. We're talking people who get more physical disabilities, who require more assistance in regards to bathing, getting clothed, food, eating, being able to get to and from medical treatments, all of that stuff. So, let me go ahead and continue here. Shortages and high turnover rates among the direct care workforce reflect demanding work and low wages, particularly among the home care workers who are direct care workers that provide HCBS. Remember, I showed you guys that out here, as of right now, the minimum start rate for our direct care work staff is sitting at $9.25, with a possibility of plateauing literally majority of the folks out here unless they get into a supervisor position or at least into middle management is about around $17.25. I literally made only $1 less than that doing my call center work for Wayfair. So, extremely telling. It is a type of work that absolutely demands a high level of skill. And then you're starting at wages far below what your general call center start fee per hour is. Just take a moment to think about that for a minute. And we're getting ready to take more cuts, which means more than likely that dollar amount per hour is probably going to be up for cut again. But let's continue, shall we? This issue brief describes states' ongoing efforts to respond to shortages of home care workers and how they pay these workers, finding that increased payment rates are a key component of state efforts to address workforce shortages. However, those higher payment rates may be curtailed under the House Republicans' proposals to cut federal Medicaid spending by $2.3 trillion over 10 years. Cuts of that magnitude, a nearly one-third reduction in Medicaid spending, would force states to raise new revenues or reduce Medicaid spending, which would place downward pressure on payment rates. Efforts to reduce funding for Medicaid could have significant impacts on the direct care workforce, in particular as nearly 70% home care is paid for by Medicaid. Now, if you're looking at a state like Missouri, I could tell you straight off the top of my head that as things are right now, pretty much everyone that is needing that direct care work, almost all of it is funded by Medicaid. I have ran into the weird areas here and there where you have people that are paying out of pocket in regards to covering the cost that's lacking, but more often than not, it is Medicaid that is covering the hourly wages for the direct care staff. That includes multiple providers, folks. We're talking Art Direct Care, Easter Seals, we're talking Nova, Judifine, Abilities First, even some of the Centers for Independent Living who opt for you being able to choose an independent direct care staff and then use your personal Medicaid funds to pay for their hourly wages. That has decreased, by the way, incredibly. That started going downhill about around 2013, 2014, if I remember correctly, because there just wasn't enough money to continue to sustain that. So these folks started to rely more hiring folks that might be family members. There's some trust there, but there may be lack of a skill set that is needed when you're dealing with medically fragile individuals that just wasn't there. So we saw a significant drop there. But let me go ahead and continue here to mention, when we're talking cuts, a lot of times what we have witnessed is hiring freezes because simply the money isn't there to be able to bring in new workers to come into this field, right? What ends up happening is they end up tightening the criteria in regards to those of us who are eligible for things such as Medicaid, in particular Medicaid for the needs within the service system. When those hiring freezes happen, that means the few that are out here, and remember folks, we're on a skeleton crew already, are taking on more than one consumer. High stress, low pay, and being overworked, going from where we had a situation before that major cut where you could literally have a direct care staff for a singular person to take care of all their needs, to the folks that are left having to take on at least about around 10 folks that they got to take care of within the space of a single day, which means the time gets cut short, right? Nobody's going to be able to stay there the entire time and guess needs prop up. Many folks who were lucky in regards to who they were previously employed by before retiring have access to places such as Oxford Care, hospice, things of that nature. But by the majority, almost none of us have that kind of access. So I'm going to go ahead and continue here before I take you into another left field. The issue brief is one of several reporting the data from the 22nd KFF survey of officials administering Medicaid home care programs in all 50 states and the District of Columbia, hereafter referred to as a state, which states completed between April and October 2024. The survey was sent to state officials responsible for overseeing home care benefits, including home health, personal care, and waiver services for specific populations, such as people with physical disabilities. All states except Florida, Indiana, and Utah responded to the 2024 survey, but the response rates for certain questions were lower. Key takeaways include All responding states reported taking actions to address workforce shortages, with most states raising the payment rates. All states reported shortages of home care workers, most frequently among direct support professionals, personal care attendants, nursing staff, and case managers. Now, back in the 2010s, when we had our first major cut, a lot of the case managers that I had already worked with for at least 2 years to 1.5 years since my time there ended up, due to those cuts, to have to actually leave their position working directly for the state. And a lot of them moved over to places like Ability First, like ARC, because the state money in regards to Medicaid was not there to continue to have those case managers and workers to be there inside the office. And the major upheaval and just general confusion, I can't even begin to tell you all the level of chaos that was going on there for like a nice, good, solid year. Literally the year like right after when I left to move on over to FedEx Trade Networks. Coding. Please send help. I hate DOS with the entirety of my soul, but not the point. Let me go again and continue here. Most 41 states reported permanent closures of home care providers within the last year. Among the 34 states that reported time-based payment rates for personal care providers, more than half paid less than $20 per hour. Another thing I want to mention, what I've noticed more on a national stage, is for all the providers who get closed down because there just isn't enough funding, all of that, those consumers tend to get absorbed by places like ARC. Here's the problem with that. ARC is taking those cuts too. So yeah. So we're losing providers and then overwhelming the few survivor providers that are still there. And part of the reason why I think the ARC has lasted as long as they have is because they have been primary and have been so big for so long. Definitely, if you're just starting out as a provider beginning to provide services of this nature, yeah, the system is overwhelmed. Hear me when I say this. The current system, as it is, has been, and currently is, still overwhelmed from the damage done from the last round of cuts. This could literally break the back of the service system. I don't want to mince words here, and I'm not going to give you false hope either. That is a very real possibility we're looking at right now. And that's just Medicaid. We haven't got to supplemental security income or Social Security yet. That's still in the pipeline. Let me go ahead and continue here. Among the 34 states that reported time-based payment rates for personal care providers, more than half pay less than $20 per hour. Missouri is those folks. To let you know how bleak all this was, as you know, my mom's radiologist. She makes about, well, I'd say at least about 2 to 3 years after specializing, her hourly has gone up. But for the longest time, it was sitting about 20 per hour. Okay? 20 per hour. Me getting paid what I was from Wayfair was considered insane to me because of what I've received in hourly rates previously. Other places, larger states, larger populations, trying to survive like $20 per hour as a direct care staff support. If you are in a state like California or if you are out in New York, oh my God. You need all the roommates. I don't know what else to tell you on that one. Let's continue here. As enhanced federal funding through the American Rescue Plan Act, or ARPA, for home care comes to an end, most states 30 are hoping to keep their increased pay rates for home care providers. Now this is the figure one we're going to be looking at here, shall we? Increasing provider payment rates was states' most common strategy to increase workers providing Medicaid home care in 2024. So we've gone a little bit over these rates previously, but we're going to go again and do it again real quick. So 48 states went ahead with increasing provider payment rates. Also developing or expanding worker education and training programs. Now these things cost money, folks, and when we're talking about training programs, remember, I used to work for the state. Anytime I got a part of a new training program, or I needed to go in and get a new certification, or any of the conferences where I had to get a new credential, guess what covered that cost for that furthering of education? You guessed it, Medicaid. It pays for the training to help develop the skills that you're going to need absolutely in this field. You cut that money, you're also cutting training. So we had a real problem about around, I would say starting about around 08 to 09 of some very unskilled workers working as direct care staff. And yeah, it didn't go well, folks. No. What we're looking at is a situation that could put us right back there with people who are not properly trained to be able to work in a field where they're going to be dealing with some very medically fragile folks who are going to need more assistance than what I got through community integration. Let me go ahead and continue here. Offering incentive payments to recruit or retain workers. Recommend a friend, right? Almost all workplaces have it. Offering workers retention bonuses. 29 states. Establishing or raising state minimum wage requirement for HCBS workers. 19. I was going to say, that was a thing in Missouri and got shouted down. Offering paid sick leave for workers. 18. Getting sick leave when you are a direct care staff is one of the most impossible things I've ever seen. The hoops these poor folks have to jump through. Remember, I know this because, yeah, my mom. Granted, her hourly work, even back then, was at a state hospital, but you get the point. That's from 2024, before Trump took office. Okay? And it's still dealing with the fallout of those 2010s cuts. Let's go ahead and continue here. Despite states' efforts to address workforce challenges, cuts to Medicaid, and changes in immigration policy under the new Trump administration may exacerbate provider shortages and reduce payment rates for home care workers. All responding states, 48, reported increasing provider payment rates to address staffing shortages. But with the House Republicans proposing $2.3 trillion in cuts to Medicaid spending over 10 years, states may need to reduce provider payment rates, which means the hourly rates go down and you become a lot less willing to start recruiting in new workers because the payment money isn't there to be able to properly train them, as well as pay them in the field, even with the abysmal rates that are the main around what they're getting paid now. Additionally, over half of Medicaid spending is for Medicaid enrollees most likely to use home care and related services, so cuts will have implications on enrollees' care. Proposed legislation by the House Republicans could also delay or overturn the Biden administration's final rule on ensuring access to Medicaid services. Beyond reducing Medicaid resources, President Trump immigration policy changes, such as restricting and eliminating legal immigration pathways and deporting millions of immigrants, may further strain the long-term care workforce, which relies heavily on foreign-born workers. In particular, in states like Missouri and out here towards the Midwest and the Southwest areas, a lot of our folks who work in direct care are people of color. It is what it is. These are the folks that have a great deal of compassion, and they get into this kind of work to really help other folks. But when you literally have a president that is flying people to El Salvador for having an autism awareness tattoo on their body, people who are here legally, whether through visas, green cards, they're here as a student, what have you, and with absolutely no due process whatsoever, no way to get a word in edgewise, they just get hauled off. That's going to make a whole lot of people think twice about getting into direct care, which requires you to be out and about and visible, okay? Alright, let me go ahead and continue here. How are states addressing the workforce challenges in home care? This is what we have going on right now. All responding states reported workforce shortages in 2024, with the most common shortages being among direct support professionals and personal care attendants, 48 states each, followed by nursing staff and home health aides, 47 states each. Now, the nursing shortages has been major news out here in Missouri. Major incentives and a whole lot of money was brought forward to encourage a lot of kids getting ready to graduate high school to go into a career in nursing. It was a massive push out here, especially within the last few years or so. Now, here's the thing. If you think cuts in Medicaid is not going to affect hospitals or hospital and nursing staff, we have waterfront property with the perfect ocean view in Kansas will sell to you for a penny. Any takers? Because it will, folks. It will. Let me continue here. States asked if they had shortages of each type of provider, but were not provided a definition of shortage. Those states also reported shortages in case managers, like the one I told you out here in Missouri, where a lot of the case managers moved into places like Ability First and into other providers simply because the Missouri state, through means of Medicaid, did not have enough to continue to retain those case managers there at the regional office. That, in fact, that mass exodus was right in the middle of happening right as I was getting ready to leave and head over to FedEx around 2012. Physical and speech therapy providers, 32 states. In some cases, states may not have reported a shortage of a particular type of provider because that type of service is not offered through their home care program. All responding states reported shortages in home care workers in 2024. Now, these are the kind of individuals I was talking to you about that work for places like Sassafras, your assisted living, places like where my grand just moved into assisted living. So, let's go again and we'll take a look at this table here. Any shortage? Direct support professionals, all 48 states. Personal care attendants, all 48. Nursing, 48. Home health aides, 47. Case managers, 47. Certified nurse aides, 42. Community-based health providers, that is 37. And OTPT speech providers, 32. Those are some scary numbers, folks. Those are some horrifying numbers. Nearly everyone surveyed. Nearly everyone surveyed. Okay? Let's continue. All states reported shortages for more than one type of provider, and 46 states reported shortages among 5 or more provider types. Such shortages may reflect low compensation coupled with demanding working conditions. In the spring of 2024, home care providers participating in KFF focus groups reported that their jobs had high physical and mental demands that were often overwhelming. Remember, I told you how a lot of those folks out here are quitting because they're being stretched way too thin without getting near enough pay to be able to continue to survive on their wages while getting an ever increasing workload. The groups described their wages as low, particularly given the demands of their jobs and how staffing shortages made their jobs harder because they may not know if they would be able to leave work at the end of their shift. In survey responses, states attributed shortages to low reimbursement rates, lack of qualified providers, and high turnover rates. This is right now before the cuts. I need you to cement that into your heads. This is right now. This is right now. Okay? Within the last year, 41 states reported permanent closures of home care providers, which were most common among adult day health programs, 31 states, followed by assisted living facilities and group homes, 27 states each. We brought that up. I told you. States were asked if there were any permanent closures of providers that offer services for Medicaid enrollees based on the location in which the providers deliver care. For a setting such as an assisted living facility or group home, a closure could reflect either the closure of an assisted living facility or the closure of a home care agency that sent workers into facilities and group homes. States were not asked to provide a reason for the closures. Some states reported closures of providers who work in enrollees' homes, 21 states, supported employment providers, 15 states, and community mental health providers, 11 states. The mental health field has been getting just repeatedly cut. I mean, let's go to figure 3 here. I'm probably going to have to cut this short. This was a little bit longer than I anticipated when I first began to go over it. 41 states reported permanent closures of Medicaid home care providers in 2024. Number of the states reporting permanent closures of home care providers by the location in which provider delivers care. Any permanent closures? 41 states? Yes. Adult day health programs? 31 states. Assisted living? 27 states. Group homes? 27 states. Enrollees home? 21 states. Supported employment programs? 15 states. Community mental health? 11 states. Most states reported closures among more than one type of provider. 37 states report closures among 2 or more provider types, and 28 states reported closure among 3 or more provider types. Such closures reflect provider shortages, while others reflect the fact that many companies have not recovered from the effects of the COVID-19 pandemic or have closed as a result of the home care settings rule. The settings rule, finalized in 2014, but first taking effect in 2023, established new requirements for home care settings, including full integration of individuals into the community and rights to privacy, dignity, respect, and freedom from coercion or restraint. That's right, and yet somehow the JRC gets to get away from that when all the rest of us don't. But that's its own subject. Back to Medicaid. All responding states reporting to taking actions to address provider shortages, with 48 states increasing payment rates, 41 states developing expander worker education and training programs, and 38 states offering incentive payments to recruit and retain workers. Less common initiatives included establishing or raising the state minimum wage, 19 states, and offering paid sick leave for workers, 18 states. States also reported other types of initiatives to strengthen the workforce, including initiatives allowing people to receive paid care from family members. Remember what I just told you about? For example, Illinois newly sought approval to allow legally responsible individuals to provide paid care for seniors participating in the home care waiver program. And I was still in my general office at the state right as that was just getting rolled out. And then we got hit by the cuts. It was a double whammy from hell, folks. I'm not going to lie to you. All but 11 states used managed care to provide at least some home care, and in over half of the states with managed care, fee-for-service payment rates impact the payment rates that managed care plans pay home care providers. Out of 37 states that use managed care to provide at least some home care, 22 states reported that the fee-for-service payment rates represent the minimum amount that plans must pay providers. One state, New Mexico, reported that the rate represents the maximum payment rate for managed care plans. 12 states reported that the fee-for-service rates do not affect payments by private plans, and 2 states responded that the answer was unknown or did not respond to the question. All right, folks. I'm going to cut it for this particular video, and we are going to be coming back in again tomorrow with this article and start on how much do states pay for Medicaid home care, and then after that we'll go into the federal. But this showing you a pretty bleak picture, and this pretty bleak picture is just what things look like now. Okay? What we're going to be looking at, if these cuts go through, is going to be absolutely catastrophic across the board. So, folks, what am I telling you to do here? What I'd like you to do is I want you to go on to the National ARC website. You can Google it. It's very easy to get on there. And on their website, they have lists of numbers in regards to your state representatives. They also have letter templates and email templates if you would prefer to get a hold of your representatives that way. I know that some folks, I know ARC is organizing having people go up to be able to go up to their capitals and speak with their representatives both on a state basis as well as national basis. They have a lot of great information, templates, phone numbers. Please go to their website. They have so much to help so that we can try to make these people wanting to make these cuts understand what it is that they're doing. Please go ahead and do so. We're going to go ahead and close out on that for today. We don't get very many views on this channel. The few we do get do tend to get removed from time to time. So please don't forget to hit the like button, hit subscribe, and folks, please don't forget to hit the comments. I do appreciate your time, and as always, folks, we here at Spilling Tea absolutely do hope you have a good one, and I will see you tomorrow with the next one. Bye-bye, everyone. And have a great Saturday. I'm going to. Gaming time is now. Bye-bye, everyone.